Does Viagra make you last longer in bed? Although there has always been a wide range of superpowers in the comic book universe, if we had to choose one, we would have to choose the ability to manipulate time. Making the happy times go slowly and the workdays go faster has several positive aspects. Who wouldn't want to spend weeks in bed instead of going to work? Enter Viagra. Many guys believe that this medication will give us the strength to overcome our most personal conflicts. Many men turn to brand name Viagra, also known as sildenafil citrate, as a solution to the age-old issue of how to stay in bed longer because it is believed to be a cure-all for sex-related problems, but especially erectile dysfunction. Is Viagra able to prevent you from arriving sooner than you would like? In actuality, Viagra might not be the greatest remedy to treat ejaculation that occurs too soon. After all, getting it going and staying with it are two different things. You can read more about the following. The data supporting and refuting the claim that sildenafil citrate increases sexual arousal. Real, scientifically supported solutions to enhance your libido and climax. But first, a few crucial details. TLDR. Does Viagra make you last longer? Many therapies are now available for premature ejaculation, including the stop-start approach, the squeeze technique, and masturbating before intercourse. Premature ejaculation sprays are based on lidocaine. Next up is Viagra. Even though erectile dysfunction, ED, is the main condition for which the little blue pill is intended and promoted, many men think that taking a dose of Viagra can make it easier to stay in bed longer. However, the proof that you can improve your game by increasing minutes isn't as strong as you may think. Think on the following information regarding early ejaculation. While there is some evidence that FDA-approved ED drugs like Viagra and others can extend your time in bed, more conventional methods of postponing an orgasm include using PE spray or masturbating before sex. See a doctor about treatments for premature ejaculation, such as delay spray and Viagra, if you are experiencing difficulties persisting for a long time. Are you horny after using Viagra? Regretfully, no. It won't make your penis bigger or stop performance anxiety either. It's normal for men to wish to increase their sexual stamina and prolong their time in bed, even if they don't fit the clinical definition of premature ejaculation. Can you live longer if you take Viagra? A little positive news first. You probably already know that Viagra can make you feel hard and stay hard, but there's a good amount of research to support its potential benefits if you find yourself crossing the finish line a little sooner than you'd like. A class of drug known as an enzyme inhibitor of phosphodiesterase type 5 is Viagra, sildenafil citrate. PDE5 inhibitors, which include Levitra, vardenafil, Cialis, tadalafil, and Viagra, tadalafil, are used to treat ED by boosting blood flow into the blood vessels and soft tissue of the penis. This can enhance both of your and your partner's sexual experiences by assisting you in achieving and maintaining a harder erection. In other words, if you frequently lose your erection during sex and have to quit because you're not as hard, Viagra's benefits may enable you to continue having sex without experiencing erectile dysfunction. After taking a dose, Viagra typically lasts for up to 4 hours. Why Viagra may be beneficial. A few noteworthy research regarding the impact of Viagra on erectile dysfunction are as follows. A small study from 2007 indicated that sildenafil, the active component of Viagra, caused men who had premature ejaculation to ejaculate more slowly. The report was published in the International Journal of Urology, official journal of the Japanese Urological Association. Men who used sildenafil had a little increase in the amount of time it took them to ejaculate, according to another 2005 study that was published in the Journal of Sexual Medicine. That rise, however, was not statistically significant when compared to a placebo. According to a 2006 study that was published in the International Journal of Impotence Research, sildenafil worked better to treat PE than other ED medications and a placebo did. A clinical trial that was written up in the International Journal of Impotence Research claims that sildenafil can shorten refractory time by a number of minutes. The study's average time decrease was approximately 9 minutes. Things Viagra cannot do. The bad news is that there isn't enough evidence from these research to recommend Viagra as a medication for prolonging the duration you can stay in bed without ejaculating. Probably the two most prevalent complaints from men with PE are the length of time they can have sex before ejaculating and/or the sensitivity they feel during sex when they ejaculate and climax. Nevertheless, Viagra has no real impact on those two concerns, even though it might lengthen your erection. Although those studies are intriguing, they are not compelling or conclusive enough for the medical establishment to recommend Viagra as a first-line PE treatment to extend your time in bed. Nonetheless, some medical professionals administer Viagra off-label to treat PE despite the lack of solid evidence in these research. Oh, and a couple other points to consider. Not only does Viagra not significantly affect the duration of time it takes for you to reach your climax and ejaculate, but it also doesn't increase your desire for sex, keep you from getting fatigued, lessen performance anxiety, or make your penis bigger than usual. Why it's important to think about Viagra's side effects first. Guys, we also acknowledge that if you want to take the Viagra approach, you will have to deal with its adverse effects. These could include everything from heart attacks and chest pain to headaches and blurred eyesight. If you are treating heart disease, hypertension, or any other medical condition, you should inform a healthcare provider. You should also stay away from drugs that could lower blood pressure, such as nitrates and alpha blockers.